So hi group, this week we're talking about pathophysiology of STEMIs and the time is muscle paradigm. So extreme chest pain is the first symptom of any kind of myocardial infarction type event, and it's brought on by the disturbance in oxygen supply to the myocardium. You have about 8 to 10 seconds before the myocardial tissue begins to move into an anaerobic respiration process, which results in some lactic acidosis that begins the chest pain. So within 20 minutes after the onset of the oxygen disturbance, the myocardium begins to die. The anaerobic respiration is not sufficient to keep up with the myocardium oxygen demand. So you end up with the tissue dying, and then the more tissue dies, the more likely you are to suffer from serious arrhythmias or to go into actual heart failure. So that just 8 to 10 seconds and then 20 minutes is just a very important marker, because once you hit that 20-minute mark, you're starting to see irreversible damage. The further out you get, the more the damage, and the more effects the person will suffer from the heart attack later on as they recover, if they are able to recover. So there's quite a bit of literature out there on this. I found an article from the Journal of American College of Cardiology, and they outlined some pretty clear guidelines for what they call door to balloon time, which is, or door to needle time, because they were including some thrombolytics in this as well. So what they were talking about was, they want 90-minute door to balloon from the time that the patient hits the hospital doors till they are in the cath lab on the table being reperfused, and a 30-minute door to needle time, meaning if they are going to use thrombolytics rather than like a PCI intervention, that there will be 30 minutes or less from the time that the patient hits the hospital door to receiving the medication. One of the reasons they do it this way is because the time before you hit the door of the hospital, EMS is not generally equipped to administer thrombolytics, and the timing, depending on what part of the country you're in and what's going on in your general area, the response times of EMS can be very different. So they measure the time from the time you hit the hospital door until intervention time. And this does save lives. There have been many studies that were reviewed in this particular literature review from the American College of Cardiology that indicates that this is really helpful, that you have approximately now a 90% survival rate from the MI, which is much improved from when they started these types of interventions. The date they gave when they really started working on this was back in 1998. So we've come a long way. There's still improvement, I'm sure, and that's really why the time is muscle paradigm has been so important. Thanks.